It's lovely to see everybody, which of course I can't see any of you, but I can see that there's quite a few hundred of you joining this brilliant session. And first thing I'd like to say is that what a fantastic experience Social Work England's Social Work Week has been. And I've managed to join a few of these, and it's been really interesting. And so I'm very pleased to be able to be leading one of the last sessions. I don't think it's the last session, but it's almost the last session. And to be able to talk about the future of mental health social work. So I am the mental health social work lead for the Department of Health and Social Care. I work in the Chief Social Worker's Office, and I have had a pretty much a lifetime of working with mental health social work, being an ASW, and then working with and managing AMPs and social workers, working with nurses and occupational therapists and psychiatrists and psychologists. So I know quite a lot about it. Now, one of the things in terms of planning this was I didn't want to just give you my views on what the future of mental health social work was going to be. I wanted to include other views as well. So one of the views I wanted to include was the voice of service users, and we're going to try and do that by working with a large group of people who did a bit of research with Manchester University. And I also wanted to include a really important part of mental health social work, which is about how we become more anti-discriminatory and include the voice of people from Black people and people from ethnic minorities. And my fantastic colleague and very close friend, Emad Lilo, is here with me today, and he's going to talk about that. He's waving. I'll let him introduce himself in a minute. And we also wanted to talk about the future of mental health social work, which is all the lovely students who are currently training to be the future mental health social workers. And one day these great people will be in charge of mental health social work. They will be the mental health social workers when I'm long retired, and they will be the future senior managers of mental health social work. So we thought we ought to include their voice as well. So I'm just going to stop there and hand over to Emad, who can just tell you who he is and what he does, why he's special.
Thank you, Mark, for this very kind introduction. I'll be very brief. I'm delighted to join you all in this very, very special week. I've been a registered social worker for almost 28 years, and in relation to mental health for the last 20 to 22 years, 21 years. I'm currently the chair of the National BME AMP Forum, and also I am a practicing AMP. You will hear from me later on where I will be focusing in relation to recent developments and its impact on our practice from race and equalities perspective. Thank you.
Thanks, Emad. That's great. So I'm going to try and share my screen. Now, the way we've worked this today is that I'm going to be in charge of some things, which is a bit scary, and my colleagues from Social Work England are going to be in charge of some other things. So we really hope it works well for you and we don't have any technical problems. So I'm going to try and put some slides up, and that will take us through the process. Okay, let's have a look at this. Right. Okay. Just going to make this into a slideshow. Right. Can everybody see that? One of you who's got your
yes, yeah, that looks good.
Yep,
all looks good.
Fantastic, brilliant. Because I can't see any of you lovely people now, so I'm just going to have to trust that you can hear me and see me. So that's the title slide. Now, one of the things I wanted to do at the start is to say that the way that we've planned this is we originally planned this. I remember talking to the lovely Iona, who works in Social Work England, and thinking there might be 20 or 30 people who might be interested in this. So we thought, oh, let's make it all lovely and participatory. And then, of course, nearly 300 people signed up, and we realized that wasn't going to work. And so we are not going to make it that participatory, but one of the ways in which we're going to try and make it participatory is to use something called Mentimeter. And we're going to ask a question, which is up on the screen in front of you now. What do you think should be the top 3 priorities for mental health social work in the future? Now, Claudia or Kate, would you like to just explain how Mentimeter works and how people can sign up for it?
Yes, indeed. So for those of you who have a mobile phone with you, a smartphone, if you want to just open the browser window on your phone, take yourself to open a new page, essentially. And write in the web address www.menti.com. That's M for mother, E, N for November, T for Tommy, I.com. And then it's going to ask you to put a code in, and the code you need to type in is 43236877. I'm going to pop that in the chat just to give people a moment, Mark, to have their phones at the ready. And for those of you who don't have access to a smartphone or who can't participate through this medium, then you're very welcome to answer the question we're going to ask on this Mentimeter poll by using the chat. So I'm just going to put the web address in.
Thank you.
And the code. So that's what people need to do for the moment.
Brilliant. Thank you very much for that.
No
and
problem.
One of the reasons we're doing this is because we'd love to hear from you. And because there's so many of you, it's hard to be able to get into that question and answer thing that we sometimes do on Teams when we have a panel. And so hopefully by the end of today, we will be able to consider some of the things that you've told us via Mentimeter, as well as considering the views of the brilliant students who've taken part in this today, and also through Emad and his work with the BAME AMP group, and also Manchester University and their work with the service user group. So by the time we've done all that, we should have everybody's views involved. So it actually will be really participatory, but in a slightly unusual way. So I hope that that works for everybody. So I wanted to start this really by just saying that mental health is changing, and I think it's changing for the better. And I want social work to be at the heart of that change, and I think social work should be leading that change. Now, I want to be clear with you today, I'm going to go on and on alarmingly about how fabulous social work is, but that doesn't mean to say that I think social work is the only profession that can lead in mental health. I've worked with some fantastic psychiatrists. I've worked with some brilliant psychiatric nurses, and I'm particularly fond of occupational therapists who we've worked very closely with, and also peer support workers, very important role that's been expanded across the country, and experts by experience, and psychologists. So there's a whole group of professions, and one of the things we're going to ask today is, what should social workers be doing? What's the special thing about social workers that means that, and what can we lead in the future? And how should we be getting excited about the future of mental health? So what I've put on here are some boring documents. They're front pages of boring documents or illustrations from boring documents. But the fact of the matter is that these are the documents that are going to help change. So, and we're going to refer to them all the way through today. So one of them, the first one, is Reforming the Mental Health Act, the white paper for the review of the Mental Health Act. And one of the things that I feel very strongly about is that although the Mental Health Act review is not perfect and is a compromise and has disappointed some people, it is still a huge leap towards a more human rights-led way of working with people who have mental health issues. And there is a massive role for social work in there. The other thing, the one in the middle, is a speech that was done by a man called Darius Livia, who is the Special Rapporteur for the United Nations on mental health. And he did some fantastic speech. He's actually a consultant psychiatrist, and he did a fantastic speech a few years ago, which I'm going to talk to you about in a minute, which absolutely challenged the fundamental ideas of how people across Europe and the world run mental health services, and really challenged us to be a bit more social work in the way that we work together. We've also got the little circle down the bottom there is an illustration taken from an NHS England publication called the Community Mental Health Framework. And that is something that is one of the big things that NHS England are leading on at the moment, but something that needs social work. And has to have social work at its very heart, and is all about a new vision for community mental health services. where we can have a new integrated vision between housing and health, primary care, secondary care, social care. And at the heart of it is the spirit of social work and the skills of social workers working in communities, working with families, working in a preventative way. And the other thing that we've got there is a King's Fund or publication called the 8 Key Areas for Social Care Reform. And that's one of the things that's happening now, is that the government is currently writing a new vision for social care. And at the heart of that, we need to understand what social work is going to do with that. So I wanted to set the scene for you, really. And now I'm going to move on to talking about some of the ways in which mental health needs to change. So the first thing is, I talked about Darius, the Latvian psychiatrist who worked for the UN for a while. And one of the things that he said is we need a revolution in mental health provision, a shift from a treatment-based way of working to a rights-based community way of working based on participatory, social and community-based services. And this came as a bit of a shock to all of his psychiatry pals and to a lot of people across Europe and across the world who were running very medicalised services. And he also said, very interestingly, that he felt that resolving poverty and increasing equality is much more effective than giving people medication. Now, that's not to say that giving people medication isn't also effective, but certainly he is right. And at the heart of that is the idea of a social model of treatment and support and an empowerment for people within communities to try and support people to deal with their mental health and to take control over their own mental health and to help communities and families take control over mental health. A move from a paternalistic way of working to a much more enablement way of working. And which group, I suppose, is currently being trained and has at its core the skills to be able to do this. Now, I would argue that nurses and OTs are very good at doing this kind of thing, but I would argue most of all that social work is the professional group that is most skilled at doing this. And therefore, when I talk about the future of mental health, what I want in the future is a mental health system in which the social model is much more powerful and at least equal, if not more, to the medical model, and that the leadership for the social model is coming from social workers. So that's the theme of today, really. And in order to start this, just to give Claudia a bit of warning to get her finger on the video button there, what I wanted to do was to start by letting you watch a video, a very short video of only about 4 minutes. But in it, a number of our brilliant student social workers, who we've particularly asked to do this because they are intending to go into a career in mental health, talk about what they want to see and how they want to see it in the future. So, Claudia, are you able to play that video for us now?
It's actually me, Mark. I'm going to play it for you now.
Sorry, Kate.
No problem.
I don't care who plays it.
No, bear with me. I'm going to share my screen and it will come up again. And if you could just...
total faith in all of you.
If you're able to just to place yourself on the do not disturb setting on Teams, that would make this a lot better. Here we go.
Hi, my name's Charlotte and I'm a student social worker hoping to go into mental health. My hope for the future is that as social workers, we are more committed to solving the little problems before they become big problems that we can't solve.
Hi, my name's Emma Grady and I'm a third year student at Edgehill University. I study mental health nursing and social work. I believe that the future of mental health services should offer more integration between health and social care and also offer more personalised community-based services. I think that people's lives are becoming more and more complex, and so the landscape of mental health services needs to adapt to ensure people's needs are met in an efficient and individualised way.
Hi, my name's Peter. I'm a student social worker hoping for a career in mental health. My hope for the future of mental health social work is that we have more open conversations about mental health, see better support and better availability of quality, attainable mental health services, and have real conversations about change. Thank you.
Hi, my name's Kirsty and I am a maths third year of nursing and social work, mental health nursing and social work, I might add. I am really looking forward to the future of mental health social work, just because I do believe prevention is the key. I think it's just a really good aspect to have, and I really would like to see a lot more funding in this area, and help people see that they have a bright future and implement.
Hello,
this.
I'm Cheyenne and I'm currently studying early years and childhood studies. My hopes for the future of mental health is for it to be destigmatised within communities for people who look like me and who are ethnic minorities in the UK.
Hi, my name's Abby and I'm a student social worker. It's my career goal to work in forensic mental health social work and also to take on the AMP role. My dream for mental health social work is to challenge the stigma for people with mental health conditions and also to see equality for people with mental health issues.
Hi, my name's Jade and I'm a student social worker interested in a career in mental health social work. I hope that the future of mental health social work commits to a collaborative, relationship-based practice that seeks to empower and enhance the lives of those we're privileged to work with.
Hi, my name is Felice and I'm a mental health and social work student. My hope for the future of mental health and social work is that of diversity in the field. I, for one, feel we need more Black people and all the underrepresented groups in social work. Considering the statistics at the moment, Black people are more likely to be detained and diagnosed with mental illness than white people. It is only right that social workers who support them are as diverse as the society they serve. Thank you.
Hi, I'm Matt. I'm in my final year of an integrated Masters in Nursing and Social Work. When I finish, I'll be registered as a mental health nurse and also as a social worker, but I'll be using both these skills to work in an integrated role. I'm excited by what these brand new opportunities are going to bring for mental health care. In line with the recent government white paper, I'm going to be using these skills to bridge the gap between services, to improve integrated care, and to treat our patients in a truly holistic way to improve their care and outcomes in mental health.
Hi, my name's Fee and I'm a student social worker hoping for a career in mental health social work. I hope for the future of mental health social work we look at a more community-based service, but also look at ways technology can enhance services.
Hello, my name is Darren Brownsell. I'm a second year student on the MNSW programme studying mental health social work. And for me, the future is about collaborative practice and getting people the services they need when they need it.
Hi, my name is Naomi and I'm a student social worker hoping for a career in mental health. My hope for the future of mental health social work is that we become practitioners who integrate culturally sensitive care into mental health practice. Thank you.
Right, well, thank you very much to all those brilliant students who made those videos for me, and it's great to be able to hear their dreams and their ambitions for the future. And as somebody who's a bit old and grumpy and probably about to retire from mental health social work in the next 4 or 5 years, it fills me with great hope that we have got brilliant students who are going to be taking the profession forward in such a fantastic way. Now, I'm going to just make sure that I carry on with this.
just while you're getting your slides up, Mark, just a quick
Yep.
housekeeping message. If people could please turn their microphones off and their cameras, and also, Mark, your slides weren't moving, so I moved them for you. So if you could move the slides through at the same time as you're talking, that would be great. Thank you.
Yes, yeah, no, okay, that's absolutely fine. I mean, they weren't actually moving at the time, but they are now. Brilliant. Okay, so I wanted just to remind you, because that went very quickly, that what the student social workers were saying. And it's an interesting, when it links to the rest of what we're about to talk about. So, they talked about integration, and that's really interesting and important. We need to make sure that health and social care are working together, but as equals, and social care and social work needs to be a leader in this, leading alongside our health colleagues. We need to adapt to new ways of working, and one of them talked about people with complex needs in the community and making sure that we work in a preventative way, and that is so important. We need to talk about empowerment and how we can support people who often have to find their way through very difficult systems, and how social work can work to increase equality by doing that. We need to destigmatize mental health. That's what one of them said, and that is so important, particularly for Black and ethnic minority people, but there are other groups of people as well. There was a great talk yesterday about Romani people and travellers, very stigmatized group that often need social work support. There are a whole range of people where we can work to a more equality way of working. We need to make sure that we have Black people within the service and that they rise to positions of power within the service. And we need to make sure that we are using technology in the future and that whatever we do is culturally sensitive. So those students really brilliantly, I think, demonstrated how the future of social work can be developed, and they obviously have got some great ideas on how to do that. So I'm moving on now to talk about service users. Now, Manchester University, and a great friend of mine called Mark, who's also called Mark, everybody seems to be called Mark at the moment, did a big bit of research with a very large group of people who had social workers, that had mental health social workers, and were service users and carers within mental health. And he asked them to list the things that they valued about social work and how they wanted social workers to be. And that list is up in front of you now. I'm not going to go through it. You can read it yourself, but just to pick out some really important bits and to try to compare how we actually want social workers to act from a management perspective at the moment. So they really wanted compassionate social workers, and they really valued the idea that social workers think about someone's whole life holistically, not just about illness, not just about medication. They clearly wanted people to fight on their behalf. They wanted social workers to to work on their behalf and help them through complex systems. They wanted people who understand abuse and neglect and can take action when needed, but at the same time, they don't want social workers who over-intervene in their lives as well. And they want to be a continuous point of contact. Now, if we look at how social work has been over the last 10 years, I'm not sure that we've actually achieved this. We've often created systems, whether it's care coordination or care management, that's about going into people's lives for short periods of time, doing an assessment, providing a service, and then getting out. And what these people who worked with Manchester University are saying is that's not really what they want. Almost all social workers, I think, well, all social workers are very, very compassionate. And I think that it's really important that we emphasize that in the training and support of social workers to make sure that they feel able to carry on doing that throughout their career. So I think it's really important here that we listen both to the students about what they want from their career and to the people who use services about what they want from social workers. And as it says at the bottom here, you know, this study found very strong evidence that the whole person approach of social workers makes a huge contribution and is very valued. So there are at the moment about 3,900 AMPs. Actually, this slide is done last year, and we've just this week had some new figures out. So it's 3,900 AMPs at the moment. There's about just over 2,800 social workers working in the NHS. Some of them in a partnership with local councils, and there's about another 3,000 to 4,000 social workers doing some aspect of mental health, not 100%, but often working in a learning disability team, but also having a mental health qualification as well, for example, within councils. So we've got a large group of people, but one of the things I'd say for the future of mental health social work is that there's a huge opportunity to expand this group. You know, we need more mental health social workers. And one of the interesting things at the moment is that the NHS and the private sector has particularly understood the value of social work and is employing them at quite a substantial rate. Now, I didn't include councils in that because councils have always employed social workers and have always valued them. But the interesting thing is, how do we make sure that those three employer groups, and we could include the VSE as well, voluntary sector, employing a smaller number but a significant number of social workers, how can we work together and have an integrated workforce plan in the future to make sure we've got enough social workers that we need to be able to do the job? And then there's some key principles for the future of social work. So what should social workers be doing in mental health in the future? Well, number one, we're very good at commissioning. We have to work with the assets of a community, and we have to make sure that we use our skills to enable communities to be as strong as possible. We work in partnership with a lot of organisations. We talk about the NHS a lot. That's a very important partnership. But we also work with the police ever such a lot. We work with the voluntary sector a lot as well. And we work with a whole range of people, including other people within the local authority, housing, rough sleeping initiatives, antisocial behaviour groups, and we work with our colleagues in children's services as well. We are leaders on the social determinants of mental health, and this is where I want future social workers to really stand up and say, I am the person who knows about equality, about housing, about getting people into work, about working with people in the communities, about working with families. And I think too often in the past, social workers have concentrated perhaps on more care management and statutory functions, which, although they're important, means that we've given some of this work away to other people who perhaps are not as well qualified as we are to do it. We do social care for everybody. There's a huge number of people, including autism, learning disabilities, but let's not forget prisoners as well, people coming out of prison, young people, people in transitions between services. So, you know, there's an awful lot that we can do. Social workers are brilliant at enabling people, supporting their carers, working with a whole family approach. Open dialogue is very much a social work way of thinking. We are fantastic at personalisation. And it's interesting when you see the NHS at the moment really pushing personalised health budgets, you have to ask the question, well, where is social work in this and why aren't we helping them? And we've got to care for our workforce. We've got to make sure that our workforce is anti-discriminatory, that it's got real leadership and training, and that we are regulated. We've got this brilliant regulator now. We've got to use that regulator as much as we possibly can to enhance our profession. So we've got a whole load of skills of social workers here, which I'm not going to go through just listing it, but I wanted to read you the bit at the side, because this is from Health Education England. This is from the leader of Health Education England, which is an NHS workforce organisation. And one of the things they've said is we have an integrated mental health workforce plan. And this plan values and recognises social work as one of the 8 key professions working in mental health. You can imagine the others are nursing and psychiatry and all the other professions that we know about. And it's really important to me that that is the case, and that we have to see both the private sector, the NHS and local authorities as being the workforce that we need to be part of and that we need to be leading in. And there's all kinds of really complex things that we do. The Mental Capacity Act, the Mental Health Act, we are experts in, Section 117, discharge, all that stuff about strength-based working, advocacy, benefits, human rights. So there's a lot to praise about social work. And when you get these slides given to you later on, you can have a look at this, which is something that we've done in Skills for Care and Health Education England and the Chief Social Worker's Office, which is the social work contribution to health and community settings. And it really summarises every single way that social workers work and all the different areas that social workers work in. And it's really important that we did this on one page because we really wanted to understand. And one of the things that we felt wasn't really understood at the moment is all the things that social workers do and all of the skills that they have. So for the future of social work, we need to make sure that we're proud of this, that we understand it, that we're shouting from the rooftops. One of the things that the Chief Social Worker's Office has done, both myself and Fran and Mark, the Chief Social Workers, we have spent a lot of time bashing our heads against the Department of Health and Social Care, the Ministry of Communities and Local Government, the Treasury, NHS England, anyone who will listen, to remind them that mental health is absolutely full of social care responsibilities and that social workers are a really important part of it. So, in terms of meeting new challenges, some quotes here. One at the bottom is from Norman Lamb a few years ago when he was the Minister for Health, saying, you know, social workers in the future are increasingly going to be located in a range of organisations, including the third sector, social enterprises, and will enable co-production. And I think that's a really important vision. Another one about increased integration, the personalisation of care requires professionals to adopt new roles and new responsibilities. And that was Ruth, who is the leader of BASWA, who wrote that. And here's something that I really liked from a social worker herself, an experienced social worker writing in community care a couple of years ago. Being a social worker isn't something you just do. It's not a uniform you put on and take off. It's ingrained with you. It's a value base embedded within you. We walk into people's lives, we make a massive difference. And I was struck by that as being very truthful, but also struck by how little we boast about that then, and actually that the voice of social work is often quite muted in a way that the voice of nursing and psychiatry, doctors and other professionals isn't. So I think one of the things we need to do in the future is to make sure we grab that voice. And we have to make sure that we respect the skills and experience of social work in mental health. This picture here on the left, on the right, sorry, is a book that we wrote that actually explains how we should be supporting social workers in all integrated services. And one of the things that we have recognised is that social workers are brilliant in crisis teams. Social workers are great at discharging people from hospital, and we absolutely should have social workers in all of these teams, that social workers should be leading transition services and should be absolutely in charge of community mental health services. So in order to look after the social workforce, we've got to understand that workforce, and we've got to make sure that there's a structure around it. And often what we find, and what we found over the last 20 years, is that social workers go into teams in the NHS, in local authorities, in the private sector, and after a while get into a thing we call role confusion. And that is because they're often, mental health social workers are often quite isolated. So imagine if you're in a third sector, you're in a mental health hospital, which is run by the private sector and which is looking after forensic clients. You've got an incredibly important role there, but there might only be 3 of you in a hospital of 150 nursing and staff and psychiatrists. And people tend to get lost within the medical model. So one of the things we've put here is about the structure that we need to put around social work, making sure that the organisations that employ them are enabling their professionalism, enabling their excellence, referring to their regulator, equipping them with the training that they need, ensuring that they are well led in every organisation. And we've put a structure around that, which people across the country are now beginning to follow. And so in terms of the future of social work, we're very much wanting to make sure that this structure supports the rise of social work and means that social workers can take much more responsibility in the future. And then finally, I wanted to talk about anti-racist social work. And I'm going to pass over to Emad to talk about this in great detail. But I think it's really important that we say that a social work prides itself on understanding anti-discriminatory practice. Every single AMP would have been on a training course about it. Every single social worker would have done it at college. And we're very, very good at it. We understand it very well. But we have to open up to the fact that we haven't actually looked after our black staff that well, that there aren't enough of them in positions of power. Some of them don't actually feel that safe within social work. And we have got to accept that, and we've got to listen to what they're saying. And I put this brilliant thing here by Wayne Reed, who I really respect and admire as somebody who's very constructive about this. Social work, he says, is institutionally racist, whether we like it or not. But there are ways to fix it. There are things that we can all do. And we've got this thing called anti-racist social work happening at the moment. 19th of March coming up soon, and we've got the Chief Social Workers Workforce Race Equality Safeguards coming up as well. So there is something starting to change and happen around that. And that is a perfect time for me to hand over to my dear friend Emad, who's going to talk in more detail about race and discrimination in mental health, both for the people we serve and for those of us who work in it. Off you go, Emad.
Okay, thanks, Mark. And I am delighted to be invited to speak in this very, very special event and special week. I will focus today around the topic of race relations and race equality, and complement the fantastic developments Mark shared with us, impacting on mental health social workers and service users. I would like to start by saying there have been developments over the past 10 to 15 years with a huge impact on race relations and race equality. Mental health social work is urgently required to acknowledge and respond to. Mental health social work is well placed, but has to develop further to meet the new challenges and changing landscape. In particular, the fight against terrorism, extremism, and radicalization, although necessary, but has had an adverse impact on race relations. Brexit, which has seen a rise in racist incidents, the scandal of Windrush, which highlighted ongoing systematic racism.
Sorry to interrupt, Emad. Would you mind turning your camera on for the audience, please? Just go up to the camera icon at the top and click on it. We can't see you at the moment.
Right.
Thank you. Oh, that's lovely. Thanks so much.
Okay. Okay.
You've put your suit on as well, Emad, so we need to see you because you're looking very smart.
Thank you so much. It's a uniform. And of course, the painful and sad killing of George Floyd and the Black Lives Matter movement. Black Lives Matter brought to the surface explicitly this cancer, unfortunately, remains in our society, and that is racism, and its manifestation denying Black people basic human rights, evidenced by the continued institutional racism within the NHS and social care. In relation to mental health, we know that Black people are more likely to receive poor service and outcomes from mental health services, with often very punitive measures when care and treatment provided, such as, which was mentioned earlier, 4 times more likely to be sectioned under the Mental Health Act. Black people are also 10 times more likely to receive community treatment orders once discharged from hospital after being sectioned under the Mental Health Act. Therefore, racial disparity in the use of the Mental Health Act is an ongoing injustice. This government acknowledged this back in 2017 and initiated an independent review of the Mental Health Act. And a year later, December 2018, the review published its findings and recommendations. The recommendations are underpinned by a commitment to modernize, review practices, and where appropriate, redesign roles, such as that of an AMP and a mental health social worker, with the purpose to reduce detention rates for all and addressing racial disparity and discrimination. The government accepted most of the recommendations from the review, which we are very glad about, and the Mental Health Act white paper, published very recently, in fact, January of this year. So please, to all lovely, fantastic students whom I love really dearly, some of you I taught, who came on that video, and I'm so glad to see them. I haven't seen them, you know, with this lockdown. But anyway, I'm getting a bit emotional. But thank you, Mark, for organizing that video. I've seen some people I haven't seen for a long time. So please read it, read the white paper, and make yourself familiar with current issues and proposed future developments for mental health social work. I will now focus and bring to your attention to some of the main direct measures and proposals to combat racial discrimination within the White Paper. As I said earlier, the White Paper follows key recommendations made by the review. So firstly, by taking action to tackle the disproportionate number of detentions of people from BME backgrounds and addressing the underlying causes of these disparities. The White Paper states they are designed to have a particular positive impact for people from BAME groups. So mental health social work need to consider as a priority, how are we going to translate this into practice and ensure its sustainability? And importantly, given historical failures, unfortunately, to translate this into practice, how do we think as a profession these proposals would make a real direct difference in the future? Secondly, the White Paper refers to and highlights the importance of culturally appropriate advocacy. So, in addition to existing advocacy services, arguably, AMPs and mental health social workers have a significant role to play here, a significant role in advocating for mental health service users, the carers, and families. But to make real difference, we need to consider and address current barriers and challenges. The third main proposal and or recommendation from the White Paper is to ensure a diverse and representative workforce at all levels. And they're saying it is critical to making a progress to address disparities and racial discrimination. The review found that parts of the mental health workforce do not reflect the populations they serve, meaning there are gaps in the delivery of meaningful support. So in conclusion, in the spirit of modernization and reviewing and re-evaluating our practices with the Black mental health service users and to support Black AMS and mental health social workers last November, with the support of Mark, excellent support in fact, and our professional body BASWA, we established the Black and Ethnic Minority AMP Forum. The aim of which is to address, promote, and champion the needs and rights of Black and ethnic minority AMPs, service users, and communities. Please, AMPs who are interested, as well as mental health social workers, to join this new forum, to please send me your expression of interest directly via email. And colleagues, I'm making my email available and my contact details. So finally, I am very passionate about our profession. I love social work, and I still love, as much as passionate and love social work after 28 years, believe me. My message for future of mental health social work, based on research findings, including developments in policy, practice, and legislation, that service users highly value social work for its focus on the whole person, drawing upon social perspectives of mental health beyond clinical symptoms. Also, service user value support that is reliable and continuous. To achieve this, for BME service users, social work urgently needs to develop further to meet the new challenges and changing landscape of mental health. Thank you very much to Mark, to colleagues from Social Work England for this fantastic event. I'm much appreciated. Thank you.
Thank you, Emad. That's brilliant, as always. And Emad has done such a lot of work. He organises the AMP conference every year, and he set up this BAME AMP group, which, to be honest, we should have done years ago, but we're doing it now, and it's fantastic, largely due to Emad. Now, I just wanted to just stop there and recap. So I suppose what we're looking at here in this section about what's the future of social work within mental health, we can summarize it like this: that social work should be more assertive, that we should be prouder of what we do, that we should understand what we do, and that we should teach new social workers what we do, and that we should have a very clear understanding of what we do and share that with other professionals and stand up for that. That social work should be leaders. We should be leaders, particularly of the social model of mental health, and the social model of mental health should be a very, very important part of the future on an equal basis to the medical model of mental health. And I suppose what I want for the future of social work is that government and all the organisations that now run mental health services understand the importance of social care, of local authorities, but most of all of social workers, wherever they might be, and that we help them do that. So, you know, having done that, having looked at that, and that vision of a more equitable and more appropriate social work approach in the future, I just wanted now just to ask Kate and Claudia, do you have some responses from the Mentimeter question? Or has everybody thought, ooh, that looks like technology, I'm not having a go at that?
We've got lots and lots, Mark, so I'll share my screen again. Always
Fantastic.
Slightly in the lap of the tech gods when we do this.
Well,
but
you can read them out if you want, if it was too scary to share the screen.
There are too many to read out. That's just to give you an indication. So I'm just loading them up now. Hopefully you can see that on your screen.
Ooh, fantastic. Well, firstly, thank you to everybody for helping us out, because we really wanted you lot to be, and I'd like to say as well, we're not banning people from putting their hands up and speaking. If you want to do that, you go for it. It's just that what we knew was that we wouldn't be able to listen to very many of you. And when we knew we had 300 people nearly on the chat, we kind of thought to ourselves, well, actually, we want to involve as many people as possible. So going through this now, lots of people saying it's all moving around in a way that I can't. Right, integrated healthcare and social care, such as community mental health teams with a clear social work identity. That, whoever wrote that, I like that. One of the things that's happening across the country at the moment is that integration is breaking down. Integration as we knew it in the 2000s, 2010, 2020, is no longer fit for purpose. I think a lot of people are accepting that. I mean, as you can see, am very elderly, and so I first joined an NHS trust as a local authority mental health social worker in 1999, I think it was, or 2000, working in an integrated community mental health team. It was fantastic. We loved it. But there were things that were wrong about it. There were things that there were mistakes that we made in those days. It didn't pan out as well as we'd expected. And even though there was a lot positive about it. So the next stage of integrated services needs to learn those lessons, keep what's good, learn the lessons. And so I absolutely agree with the person who wrote that. We need an integrated community mental health team, recovery and rehab service, but we need to make sure what is the role of social work within that and how can we emphasize it. Another interesting thing is about the increasing social work numbers in the care coordination role. And social workers working in hospitals, discharge planning, Again, I totally agree with that. I know some areas across the country where social workers are doing a fantastic job working with people from the moment they arrive in hospital, sorting out their housing, sorting out their debts, sorting out family issues, and getting them constructively discharged with a brilliant Section 117 aftercare plan. And I think that's something that social work is very, very good at, and especially for those people who are trapped in hospitals, who are a long way away out of area placements. One thing in that I would ask us to question, though, the role of care coordination. Now, I happen to know that I think it's fair to say that CPA, the care program approach, is probably about on the verge of being reformed. And so the question we have to say is, what's the future for care coordination? It has had some advantages, but it's also been very, very administrative. And I think nurses and occupational therapists and social workers are all questioning how it has affected their professional identity. So there's some questions to work out with that as well. There's some really, really interesting responses here that I really like. So I'm going to go through them all later on when they've stopped moving around. However, one of the things that I noticed just now was around the importance of prevention. And I think that's a real challenge for us in social work. Do we get involved with crisis work, or do we get and discharged from hospital, or do we work in communities and work very much in a preventative way? Well, the answer to that, from my point of view, will be we do both, but we perhaps need to differentiate how we do it. And what's happening in a lot of community mental health teams at the moment is that it's all being overwhelmed with crisis work, and the preventative work is often being quite difficult to do. So I think we need to reorganise the service so that crisis work can be done by properly funded crisis teams, and they must have social workers in them. Social workers in A&E, social work is very important in that part of the service. But those people who are going out into communities and working in a constructive way to try and stop people from deteriorating and having a real look at community mental health and prevention, that's very important as well. So there's some fantastic things there. Is it possible, Kate, for us, are we allowed to summarise all of this and send it out to people?
Well, the session is being recorded, but yes, we can carefully collate this and hopefully share it back out with the sector, because it's their words shared with us, really. So we will. Yeah. You've got many responses here. This is just the tip of the iceberg.
Yeah, and obviously we can't read out all of them. We've only got a couple of minutes left, but it's going to be, there's a number of very useful things here. The feedback from the students is incredibly useful, because they are the future, and we need to make sure we're creating a social work that they're going to want to work in. The feedback from Black and ethnic minority people about how it feels to work in it now and what they want it to be like so they can work safely in the future is incredibly important. The feedback from service users saying this is what I want from my service user, from my social worker, is obviously, you could argue, the most important aspect of it, because that's what we're all here for. But this stuff that you're writing for us now on the Mentimeter, the views of 270, 280 people around how you want social work to develop in the future, that is a massive resource. And I'm very, very grateful to you all for putting that effort into it. Because I think it's really important. So, we've tried to cover as much as we can today, and I think what we've learned probably is that there's lots of mental health social workers who love being a mental health social worker, as I have throughout the whole of my career. However, in the future, we need to sort out some of the problems with it, and we need to really concentrate on what's good about it, what we're proud of, and we need to plan a new vision for mental health social work that takes us into the next 10, 20 years and makes those social work students we saw earlier on really, really pleased that they chose this career. So on that positive note, I would like to say thank you very much, and to thank all of you for coming. Thank you, Emad, for helping so much, especially at the last minute. You're a star. Thanks to all the lovely students who recorded themselves. Thanks to all the service users who spoke to my Manchester University friends, and thank you to Social Work England for giving us the opportunity.
Thanks, Mark. What a wonderful session to you and EMAD. It was really powerful, tackling anti-racist practice and EDI issues, which of course is one of the 4 main themes running through Social Work Week. And for those of you who joined us today, I hope you've really enjoyed Social Work Week, really important first for the profession. I want to also just very quickly see if Laura, our resident roving illustrator, can show us her work for the day. Hello, Laura. I forgot to mention you at the beginning, but I know that you've been illustrating the session for us. What have you got?
I forgot you as well, Laura. Massive apologies.
No, don't worry. Don't worry. I'm used to it, but hopefully I'll deliver an unforgettable summary. So, can I have permission to share my screen if that's okay? I don't think I have permission to do that just yet.
Bear with me. You're on my screen. You're spotlighted. You're good to go.
I can't share my screen though.
Oh, I'm so sorry.
No,
Let's do that for you.
There we go. Perfect. Thank you.
Lovely.
Okay. Can we all see that? Can we have a yes? Perfect.
Yeah, fabulous.
So this is a quick run through of our session today. So if we start in the bottom left, we started talking about the policy kind of changes that are happening at the moment around mental health social work, and we talked about the white paper and this new vision for social work within mental health, and that there's this focus on social care for all. Mark then talked about the social model being at the heart of the future of this change, and we're moving from paternalism to this enabling kind of rhetoric where social workers are at the core of this model. We then looked at our hopes for the future from our very enthusiastic and lovely students that made me feel very old. And they talked about that they would like the future to be community-based, collaborative and integrated, preventative, anti-discriminatory, reflect the diversity of the communities that you serve, and are culturally sensitive. We then touched upon some of the service users' ideas, and they wanted social workers that are compassionate, have a whole life approach, are non-judgmental, help us access support, and also are a continuous point of contact. And then we looked at the key principles underpinning this future, and they were, I know it's slightly small on my screen, so I'll go through them: community commissioning, partnership working, leading on the determinants of mental health, leading on user involvement, promoting care for all, and caring for the workforce. And then EMAD took us through an incredible speech on anti-racism, looking, and I really liked what he said about, you know, the cancer of systemic and institutional racism, and that Black people are 4 times more likely to be sectioned and 10 times more likely to receive treatment orders. And that we're looking at the January white paper, I'm thinking about the sustainability of some of these recommendations within social work, and again trying to rectify the lack of diversity and the need for culturally sensitive advocacy. And he ended with this focus on the whole person and the kind of enthusiasm for our future students. And then the top banner there, the top kind of cloud, are some of the things that Mark ended on, which is about being assertive, proud, leaders, equitable and integrated. And a bonus image for those of you that are here, because I can share the key themes of the week as well. So this hasn't been seen yet. These are the 8 key themes that have run across the whole spectrum of sessions I've seen this week. And they are anti-discrimination, both in practice and values, reasserting the social work values and those of Social Work England to be integrated into practice, improving staff support, embedding co-production at the heart of everything you do, ensuring that we use innovation across digital technology, practice and people, strengthening relationships and listening, ensuring we have evidence-based practice, and also encouraging allyship across kind of homophobia, transphobia, racism, all of the kind of the phobias and isms, to ensure that we're standing up and being counted. So thank you very much for having me. That's a whistle-stop tour not only of your presentation, but also the week so far too.
Absolutely wonderful. Thank you for that, Laura. Really, really grateful. You've done sterling work. You must be exhausted. Particularly like seeing the end slide there. That sort of captures the theme and very much the session that we've had today with Mark and EMAD. So just conscious of it's a bit naughty, but thanks There's a quick survey in the chat for you all to complete. It takes 2 minutes. Just tell us how you found today and whether you've enjoyed it. All the feedback is very, very welcome from us. And you will be able to watch this session back at a later date on our YouTube channel because it's being recorded today. So thank you so much to everybody for joining us and for taking part. And hope you enjoy the rest of your weekend, and we'll see you soon. All the best.
Thank you. Thanks for listening. Thank
Bye
you,
for
Laura.
now.